Hi, it's Dr. Shelley, and you had homework. What was your homework? You were supposed to watch Grey's Anatomy, Season 1, Episode 1. And yeah, you're not paying attention to the fact that Meredith just slept with Dr. Shepard. That's irrelevant. What you are paying attention to is the fact that basically, I'm Dr. Bailey. Oh yeah, let's go. When I move, you move. Are you ready? Let's go. So with the help of Grey's Anatomy, and me explaining how it applies to the next generation NCLEX exam and how you're going to pass it with flying colors, because I am going to teach you Shelley's case studies. We can get started. Here we go. Do you remember? You did your homework. You watched Season 1, Episode 1, Grey's Anatomy, Netflix. When you watched it, you know, if you're honest, there was a 15-year-old female with new onset intermittent seizures. During the past week, the patient is having grand mal seizures now. Labs, tox screen were with the normal limits. Diagnostic tests and scans were initially normal as well. Her history includes a twisted ankle during gymnastics, but no head swelling noted after the fall. She denies headaches, denies neck pain. She was seen by her primary care doctor back home, and then she was sent to, you guessed it, Level 1 Trauma Center on Grey's Anatomy. Now, after stabilization, the patient calls out to say her head feels full. Remember that? She called Meredith to say something stupid, and she was like, I can't sleep. My head feels full. That was a hint. Her head was feeling full for a reason. A few hours later, the patient begins having multiple grand mal seizures. She received Valium ×2, Ativan 4 milligrams, phenobarbital with no change, all those drugs. And let me tell you something, you better know your generic names because we're going through all that with this case study. So she received all of those meds and it did not work. Then the patient flatlines and codes, you know what that means. And then they were able to bring her back to VFib after 2 defibrillation shocks. And then she had a return of spontaneous circulation after the 3rd shock. I mean, seriously, this is a case study. Now, the first thing you do when you're looking at a case study is you look at the study and you think, well, what system of the body is this dealing with? This is dealing with neuro. So your answers need to be about neuro. And if we look at this, there's also some other juicy tidbits in the case study. I'm going to teach you all about the language of NCLEX, right? Because you're trying to pass the next generation NCLEX exam. You're trying to pass the old one if you listening to me and you got a test coming up. So here we go. New onset. Let that word hit you in your gut. Because anytime you see the words all of a sudden, new onset, status change, that means see that patient first, because this is not their norm. New onset is a prioritization question. You've got to pay attention to it. Now, the intermittent seizures. Once I said the word seizures, you knew this was a neuro patient, because there's basically 5 issues with neuro patients: headaches, high blood pressure, seizures, brisk DTRs, and very often clonus. Now, if you don't know what DTR is, that's called deep tendon reflexes. So if I were to check her reflexes, they'd be brisk. If I were to check her blood pressure, it might be high. One of the things that you don't learn in school about the neuro patient is, even though the neuro patient is always high blood pressure, and be careful with the word always, but usually high blood pressure, it's also usually a low pulse. So bradycardias go with neuro patients, not usually anybody else, okay? Now stay with me. She is having grand mal. Grand means big, mal is French for for bad. She's basically having big bad seizures, and she's having them right now. So you saw the helicopter in Grey's Anatomy land down on the tarmac, and you saw that she was what? A fish out of water, which is what I think Dr. Burke said. Now, what are you going to do first? Oh, let's pretend. Shall we role play? Are you ready? Stay with your girl. All of a sudden, I'm about to have a seizure. What are you going to do first? You're going to guide me to a flat surface. That was number one. You're going to move everything out of my way, because if you just look around here, all of this stuff could hurt me. So you're going to move everything out of my way. You're going to make sure, that was two. You're going to make sure you turn me on my side. That was three. You're going to make sure that you loosen restrictive clothing. Now, what does that mean? Because right now I just have a jogging suit on. Would anything be restrictive? Not really. But what about the patient in the hospital? They could have a hospital gown. At that point, you're going to loosen those strings. Just loosen them, because that string could get all caught up in them as they flip and flop and flop and flip. Now, so you did that. So are you paying attention? Oh, probably not. Let me just review with your crazy behind. 1, guide me to a flat surface. 2, move everything out my way. 3, make sure you turn me on my side. 4, loosen restricted clothing. 5, cradle the head. What the heck does that mean? Get down there on the floor with that patient. Get very close to the patient. Never restrain the patient. Never put anything in the patient's mouth, but you get so close to that patient that their head is able to touch your soft knees or legs, as opposed to the hard floor. So cradling the patient, pretend my arms are my legs. Your legs can be like this. The patient is in the border of your legs. So if they hit the legs, it's no big deal. And then what you have to think about is how to keep this patient from having a head injury, because patients die from seizures for 3 reasons. 1, head injury. 2, hypoxia. 3, they aren't swallowing very well, so they aspirate. Doesn't matter which one, all 3 are deadly. So all of the actions that you just did, from guiding me to the flat surface, to moving everything out of my way, to turning me on my side, to loosening the string on my gown, to cradling my head, was to prevent head injury, aspiration, and hypoxia. Because when I'm seizing, I can't swallow, and I'm not doing that great a job at breathing. So this is why it's a huge priority. Now, once you've done those things, you've cradled the head and all, you're timing the seizure. How long is too long? Stay tuned for the next video. Oh, if any of this was slightly confusing, it's okay, because a full neurovascular system conditions and diseases is right there on HETV under the playlist for neuro. Talk to you later. Hope you learned.